So advancements in GYN surgery have really come to include doing a lot of procedures in a minimally invasive way when traditionally they had been done in what we call an open procedure. And the difference in a minimally invasive and an open procedure is not only the size of the incision. So when we talk about an open procedure, we're generally talking about a large incision. Minimally invasive procedures generally are much smaller incisions in your belly. It's also about the length of hospital stay for the patient. It tends to be much shorter with minimally invasive surgery. The amount of pain the patient's in, which also tends to be much less. The recovery time for the patient tends to be shorter. Another way that GYN has advanced is through medications and through procedures that we can do in the office. We have a lot of different options, for example, heavy uterine bleeding, that were not necessarily options to our mothers and our grandmothers. The main procedure that can be done minimally invasively that we talk about a lot as GYNs is a hysterectomy. By hysterectomy, I mean the removal of the uterus and the cervix. Sometimes that also includes the fallopian tubes and the ovaries. Traditionally, this was done through large incisions and now through the smaller, minimally invasive incisions. And sometimes no incision at all. We can completely remove the uterus from the body. We also use minimally invasive techniques to do surgeries on the fallopian tubes, such as removal of the fallopian tubes, removal of the ovaries, removal of cysts or tumors on the ovaries, surgeries for endometriosis, and a variety of other gynecologic abnormalities.